is Vince Gerald M. San Miguel, a first-year nursing student from Nueva Ecija University of Science and Technology. And today, I will be providing perineal genital care. So, let's go! For the assessment for this procedure, are first, assess the client's status, identify cultural preference for perineal care, assess the client's perineal health, determine if the client is incontinent of urine or stool, and lastly, assess the client if he or she recently had genital or perineal surgery. For the planning for this procedure, the expected outcomes in this procedure are first, the genital will be dry, clean, and free for secretion and unpleasant odor. Next, the client will feel comfortable and clean in perineal area. Next, the client will not experience uncomfortable or undue embarrassment during the procedures. And lastly, the perineum will be free of skin irritation and breakdown.
The equipment needed for this procedure are first, personal protective equipment, gloves, gown and goggles, toilet paper or washcloths, waterproof pads, cleansing solution if needed, perineal wash bottle, water receptacle, dry towels, perineal treatment, linen receptacle, and room deodorizer.
Intervention for this procedure are first, wash your hands, put your gloves, if necessary, put your gown and your goggles. The rationale behind this is to reduce the transmission of microorganisms for the safety of the client and for the safety of yourself. Next step, close the curtain and close the door. The rationale behind this is to provide privacy for the client.
Position your client. If perineal care is to be performed in the bed, place the client on her side or over deep bedpan.
Next step, put waterproof pads under the client in the bed. The rationale behind it is to provide the bedline. So this is how you do it.
Next, removal of fecal dermis with disposable paper and dispose in toilet. The rationale is may require several attempts if performing at bedside may collect paper in disposal pad or lines until the end of procedure. Spray perineum with washing solution if indicated. Alternatively, plain water may be used. The rationale is several perineal solutions are available which may or may not require rinsing. Carefully evaluate this requirement. Solutions that require rinsing may cause skin breakdown if left on the skin. Cleanse perineum with wet washcloths front to back on females, changing to clean area on washcloths with each wife. The rationale is maximize cleaning, prevent spread of rectal flora to vagina. Carefully examine gluteal folds and scrotal folds for derivatives. Gently visualize vulva for derivatives. The rationale is fecal material causes irritation and skin breakdown rapidly when left in contact with skin. If soap is used, spray area with clean water for the perineal bottle. The rationale is rinsing soap which can irritate the skin from the area. Change your gloves. The rationale is to reduce the transmission of microorganisms. After that, dry perineum carefully with towel. the rationale is reducible moisture provides an ideal environment for the growth of microorganisms. If indicated, apply barrier lotion or ointment. The rationale is barrier ointments may be used if the client is incontinent or skin folds tend to harbor moisture. Reposition and dress client as appropriate. The rationale is to promote client comfort. Then, dispose of linens and garbage according to the hospital policy. The rationale is to prevent spread of disease or bacteria. Wash your hands. The rationale is reduce the transmission of microorganisms. Deodorize room if appropriated. The rationale is to promote client comfort. This may also be done at the beginning of the procedures. For the evaluation for this procedure, the perineum and genitalia are dry, clean, and free of secretions and unpleasant odors. The client reports feeling comfortable and clean in the perineal area. The client did not experience discomfort or undue embarrassment during the procedure. For the documentation, nurse's notes, document the time and type of perineal care provided. Document any unusual findings such as skin breakdown, infection, or unusual drainage. If the client has special preference or cultural consideration, be sure to document that these were respected.
Again, student nurse Vince Gerald M. San Miguel from Nueva Ecija University of Science and Technology. Thanks for watching.